Hello, my name is George Gluck, and I am Green Party candidate for Congress in Maryland's District 8. Since shortly after college graduation, I've been a resident of Montgomery County. I married my wife Phyllis, and we've raised our 2 children here. We now are watching them raise our 5 grandchildren here as well. Someone watching this video does not have health insurance. Someone watching this video has had a medical emergency, or knows someone who has had a medical emergency. And the insurance company has said, no, we will not pay for it. Maybe it's a family member or a friend or someone you work with, or maybe it's you. That's the story for millions of Americans right now. Over 50 million do not have health insurance, and 26,000 Americans die each year as a result. Millions more have inadequate health insurance, not enough when they face a serious illness or accident. Many people believe they have good health insurance until they have an emergency. When that happens, it means personal bankruptcy, financial ruin, their life savings wiped out. Over 60% of all bankruptcies filed are the results of overwhelming medical bills. And nearly 80% of bankruptcy cases involving medical debt were from people who had health insurance. America has the best medical technology in the world, but we have one of the worst medical delivery systems, ranking 37th in the world. There's a solution to this crisis. It's called Medicare for All. Sometimes people call it single-payer national health care. Medicare for All is simple. We just expand Medicare to cover everybody. Did you know that the President and members of Congress have their own version of Medicare for All and get some of the best medical care available in the country? We should make that medical care available to everyone. Medicare for All will cover every American, regardless of employment, ability to pay, age, or prior medical condition. Medicare for All will provide everyone with high-quality medical treatment and a full choice of doctor and hospital. Decisions about medical treatment will be made by doctors and patients instead of insurance company bureaucrats. No one will get broke because of a medical emergency. Medicare for All will boost the U.S. economy by abolishing the financial burden on businesses to provide health care benefits for all their employees. Americans would pay for Medicare for All in the same way we pay for Social Security, but will pay far less because the high cost of private insurance will be eliminated. Private insurance raises the cost of health care as much as 30% to cover administrative overhead. Compare that to Medicare's current administrative overhead of only 3%. Medicare for All will save money in many different ways. It will allow bulk purchasing of medications and durable goods. With Medicare for All, overall medical expenses will be cut by about 10%. Insurance companies make their profits by restricting medical care and by denying treatment to people who need it most. If you have a heart condition or you're over 60 years old, they don't want you as a customer. For-profit health insurance is designed to make money for insurance companies. It's time to replace it with Medicare for All, which is designed to deliver health care to all of us. What about the Affordable Care Act? The bill that Congress passed and President Obama signed in 2010. The Affordable Care Act serves the interest of insurance and other corporate lobbies. The Affordable Care Act requires everyone to purchase private health insurance. That's what individual mandate means. The mandate is a direct public handout to sustain private insurance industry. Even with the mandate, the Affordable Care Act leaves 23 million Americans without coverage and many millions more with inadequate health care. The Affordable Care Act is a gift on a silver platter to insurance companies that send millions of dollars in campaign checks to politicians. Democratic Party leaders declared Medicare for All off the table. President Obama even dumped the public option during backroom meetings with lobbyists. Americans have a right to question whether it's legal for government to force us to enrich private companies by purchasing their low-quality health insurance policies. Americans recognize that people have a right not to spend their final years in poverty and despair. That's why we have Social Security. The demand for Medicare for All is based on the same principle. It's time for us to recognize health care as a human right instead of a cash cow for corporate middlemen who take our money but don't actually provide as much as a single Band-Aid. The Green Party supports Medicare for all. Unlike Democrats and Republicans, the Green Party and the Green candidates do not accept corporate campaign checks. Green Party speaks for a majority of Americans on health care reform. A 2007 CNN poll showed that 64% of Americans believe that government should provide a national health insurance program for all Americans. Please help us to win Medicare for all and make high-quality health care possible for every American. Learn more about the Maryland Green Party at our website, mdgreens.org.